Hello, everyone. I'm Jamie Bearse, CEO of Zero the End of Prostate Cancer. And we have teamed up with Exosome Diagnostics to create a partnership to support education and awareness for men and families dealing with prostate cancer. And this program today is a joint event on Facebook Live. Today, we invited Dr. Ali Kasraeian to speak about the challenges of prostate health during this pandemic crisis and to educate us on non-invasive and powerful in a non-invasive and powerful diagnostic test called EXO DX Prostate, and it can discriminate between high and low-grade prostate cancer. For those of you who are new to Zero, at Zero the End of Prostate Cancer, we are the leading national nonprofit with the mission to end prostate cancer. It's right there in our name. We advance research and we improve the lives of men and their families, and we inspire action. We're building Generation Zero, one step at a time, the first generation of men free from prostate cancer. And through our National Run Walk series, which will be a virtual celebration this year, and we'll be talking about that and why, because of the COVID-19 pandemic. But we also supply education and patient support programs and activities, and do grassroots advocacy aimed at increasing prostate cancer research and improving access to care. Zero is recognized as a 4 out of 4 star charity on Charity Navigator, and we're accredited by the Better Business Bureau, and we dedicate 86 cents of every dollar that comes into the organization toward our programs. And Exosome Diagnostics is a biotech that's based in Boston, Massachusetts, and they're focused on helping patients with what I would say is a critical and revolutionary diagnostic tool to deliver personalized precision healthcare that is improving many lives of prostate cancer patients or those who are at risk. And we'll get into sharing the reasons why it's so critical in just a minute. But the ExoDx Prostate test is also included in one of the most recent National Comprehensive Cancer Network guidelines, or the NCCN guidelines for short, for early detection of prostate cancer. And also recently received the FDA's breakthrough device designation. It's covered by Medicare, and it's available in all 50 states. So let's dive in to get into why it's important right now about diagnostics around prostate cancer, especially during a pandemic. And to do that, again, I'm pleased to welcome Dr. Ali Kasraeian to our Zero Live. Dr. Kasraeian is a leading licensed urologist and surgeon, providing general and specialized care to residents in northeastern Florida at Kasraeian Urology in Jacksonville. Ranked among the top 7% of physicians alongside his father, Ahmad Kasraeian, by the US and World News Report. Dr. Ali Kasraeian is one of the few fellowship-trained advanced laparoscopic and robotic that's a mouthful, urologic surgeons. I don't know how you do it every day, Ali, in Northern Florida. In addition to all that, in addition to practicing at Kasraeian Urology, when he's not helping patients, he's affiliated with over a dozen hospitals and medical associations, from the American Cancer Society to the Society of Robotic Surgery. And Dr. Kasraeian, or as I know him as Ali, has won many awards, including being named among America's top surgeons by the Consumers Research Council of America. Welcome, Ali. It's good to see you again. How are you doing?
Again, I'm good. It's been definitely interesting times, and hopefully we as a medical community will learn some things that will allow us to do better in the times moving ahead. We're very proud to have partnered with Zero Cancer, and we brought the first run walk here to specifically designated for prostate cancer here to Jacksonville, Florida. I think it was 2016. Again, our community is a big, again, we're in Northern Florida, so a lot of runs dedicated to a lot of things. But interestingly, not too many dedicated, not any dedicated to prostate cancer until we did that for the first time. We're very proud to partner with Zero to do that. And like you're mentioning, why is it important to look at more personalized ways of managing or thinking about the diagnosis of prostate cancer? to get to your goal of ending prostate cancer. And the ExosomeDx test is one critical step forward in trying to figure that out.
Oh, great. And your family is safe and well at home, and I
Yeah,
hear.
I mean, so I actually have a 2-year-old and a 5-month-old. So one of the, if one can think about it this way, one of the positives of the past few months has been the opportunity to use telemedicine to be able to see our patients and see them in a very location sensitive way. So patients don't want to necessarily leave their home because you want to make sure that they're safe. So you're allowed to, you can see them in a very safe way, keep the patient safe, keep our staff safe, but you can actually see patients in a very time efficient way. So I've been able to get home a little bit sooner and be able to spend a little bit more time with my family, which having a very new baby at home has been a little bit nice. So so I've been very grateful for some unexpected time, a little bit less travel, and so I cannot complain about that. So that's good.
That's good. So while you and I and really virtually everybody else practically, except for our essential workers, like you sometimes are at home, so are many men who have prostate cancer on their mind. There are many men who still worry about prostate cancer as this pandemic, as the COVID-19 pandemic continues. How are you able to manage I know you talked a little bit about telemedicine, but how are you managing your patients in your practice at the height of the pandemic, and how has it changed now?
So there are a couple different ways of thinking about that. So one is your established patients who have prostate cancer, who have been treated, and you want to follow them up. So telemedicine is a great way to make sure that you keep up with those patients, to follow up on their PSA levels, and so make sure that they are reassured that they're continuing to do well. You know, make sure the people that need to be evaluated, followed up, and people that need further therapies because their PSAs are changing can be seen and their case managed and discussed, have those follow-up in place, and telemedicine allows you to do that. Then you have the people who are in the process of having their elevated PSAs managed. So people who are in the midst of having their elevated PSAs looked at, they need biopsies and things of that nature. So that's a little bit of a delicate situation during that time where this pandemic really began. They had biopsies that were scheduled. How do you balance that? So that was one population that was a bit of a challenge. And then you had a large number of patients that nationally we had a bit of a challenge of how to deal with, where they had surgeries scheduled, they had radiation therapy that was scheduled, they're in midst of therapy. How do you deal with those patient populations? And then you had the men who were in the beginnings of, you know, I have an elevated PSA, what do I do? How do I begin those conversations? New patients that had seen a primary care doctor and they needed an evaluation with a urologist. And, you know, we were able to kind of see those patients with telemedicine, and it actually allowed for a very efficient way to get to the next step of the live appointment as we made our way through the immediate portions of the pandemic, leading to the next step of the segue to our live appointment or reentry to the live appointment. And the ExosomeDx test allowed a bit of that, because we're very proud to be part of the initial test or the beta portion of a home ExosomeDx test, where we were allowed to participate in sending our order through an electronic order to the company, and they would then send out the test to the patient's homes. They would deliver this urine-based test. They would complete the test and then send it to the company. The company would perform the test and then send the results directly to us, and we can actually discuss the result with the men via telemedicine, and then come up with a game plan of what to do, and come up with a discussion which was very personalized, very accurate, and very appreciated, both from us as the physicians trying to decide what to do, and the patients who were very concerned about what their elevated PSA meant.
And so what I'm hearing is that your practice was one of the first ones to actually start using the test and being able to really roll it out across the country.
Yeah, so with in this home format. So basically, we wanted to see how do we go through the logistics of delivering this test in a the physician and the patient decide this is a test that could be beneficial for the decision-making process of what to do next. Can we efficiently go through the process of ordering it through the office, the physician order process? Can we then send it to the patient accurately? Could they then figure out how to do the test, collect the specimen, send it back to the company get enough specimen accurately to run the test, and then deliver the result to the physician's office in a way that is time efficient and accurate. And they were very, very efficient in terms of doing all those steps to then be able to roll it out nationally, which was very impressive. And it was done in a very, very short order of time.
That is impressive. Now, to take a step back, Dr. Kasraeian, why and when would you use the ExoDx prostate test for those at risk and those prostate cancer patients who have maybe have had a high PSA? When's the right time to use it? When
So one of the things in terms of prostate cancer that is a very challenging discussion. So prostate cancer screening is one of the most controversial screening dilemmas and discussions in the discussions with cancer screening. Since its inception in the early 90s, late 80s, and when we started using the PSA test to screen for a cancer, and it specifically here is prostate cancer, we've seen a significant, almost greater than 40% decrease in deaths from prostate cancer. However, there's been a criticism that we've diagnosed a significant amount of cancers that may not necessarily lead to men dying of those prostate cancers. So we've diagnosed what has been termed as clinically insignificant prostate cancer. I don't necessarily like that term because if someone has cancer, it may not seem insignificant to them, but it's basically not aggressive cancers that could lead to death. Essentially low risk, low prostate cancers. And what we need to do is find a way to differentiate between those less aggressive prostate cancers that, if diagnosed, can potentially be monitored and don't necessarily kill someone, versus the cancers that are more aggressive and can lead to death. And the PSA test is not necessarily sensitive enough or specific enough to differentiate between those. I like to describe prostate cancer to patients as four types. There are rockets, rabbits, and turtles, and snails. So rockets are metastatic prostate cancer that are associated with very high PSAs and are metastatic at diagnosis. Fortunately, incredibly rare. Then you have the rabbits, which are the prostate cancers that tend to be more aggressive. They have legs, they can get out of the prostate. So if we find them, we'd like to treat them so that we can avoid the possibility of metastatic disease. Those are really the ones that we want to find. Then you have turtles and snails, slow growing, slow moving cancers that, if found, may not necessarily lead to death. So right now we've actually done a great job of increasing the amount of active surveillance that's done worldwide. So we've kind of shifted the paradigm of over treatment and over diagnosis, which has plagued a lot of the recommendations against screening for prostate cancer. So what the ExosomeDx does with an easy to do urine-based test is it helps differentiate between the elevated PSAs associated with the rabbits, the prostate cancers that are a little bit more aggressive, that if diagnosed, probably need to be treated because they could be associated with a prostate cancer that, if left alone, could become metastatic, versus those lower risk, low volume prostate cancers that are unlikely to cause death. And so with a simple test, you can find out if someone has an elevated PSA, could we safely avoid an unnecessary biopsy if you have a low ExosomeDx test, versus if someone has a higher ExosomeDx test, then that may be someone that it may not be safe to avoid an unnecessary biopsy.
So it's incredible so they can have it at home and be able to tell through doing this test if they've got a rocket or a rabbit, or if they've got a turtle or a snail. And so a rocket or a rabbit, we can match up aggressive treatment to go with aggressive prostate cancer, or take a less invasive approach on the turtles or the snails, depending on your personalized situation.
Nowadays, we have even imaging. We could do a specific MRI scan called a multiparametric MRI that can allow us to look within the prostate and see if there are areas within the prostate that may be concerning for a prostate cancer. And we now have technology that allows us to target that and do a biopsy of that. And it can give us, again, more personalized, more accurate diagnostic means to get more personalized and more accurate information about specifically what's going on within your prostate.
And then, Dr. Kasraeian, how does the test work? I know we talked about a urine test. Like, tell us. I'm sure that there are guys out there watching it that do we have to drink whole full bottle of seltzer water?
No, it actually just catches kind of like the first beginning portion of the urine and doesn't need much urine to get the test. And for that reason, it actually has this kind of, very interesting contraption that you urinate into to try to very specifically catch that first portion of the urine to get more prostatic portion of the urine to be evaluated. So the device tries to make it very, very simple for the urine to be appropriately collected. From that standpoint, you collect it, and then the instructions are very simple within the device, and then you package it, and then you send it away from that standpoint. The technology of this of the ExosomeDx is also really, really interesting, and it actually probably has far more reaching applications than just prostate cancer. So not to get too esoteric, but the exosome is basically just this little vesicle, or this little kind of portion that comes off cells, like a little essentially a blip or a little circle that comes off of cells, which until very recently we didn't think contained much valuable information within it, until the gentleman that is a main scientist and the developer of this company, found that there was a small bit of RNA or a bit of genetic information within it that can be used to find information and harbor information of the genetic or cellular information that could be very valuable to find out what's going on for a lot of different things. Fortunately for us as urologists and people that specialize in prostate cancer and care about prostate cancer, they decided to focus the genetic information and the useful clinical information that could be derived for prostate cancer and the risk associated with prostate cancer matched with an elevated PSA, and with a lot of amazing science and amazing research, and a lot of really great validation studies, they found that if they look to see what is coming in that genetic information on the exosome, could we see if the elevation in the PSA can be associated with a prostate cancer that can be related to prostate cancer that could be really clinically significant versus one that is not as likely to get metastatic and cause death in the future. Very, very powerful and very important for us to try to make sure we don't miss cancer that shouldn't be missed, and potentially avoid a biopsy that we could potentially avoid.
Now, how are you coming across, you're on the front lines working with patients on administering this test to be able to determine if something's a rocket or a rabbit or a turtle or a snail. Are you finding that the administration of this test and talking to patients about it relieves some of the fear and anxiety that comes with a biopsy, or just the fear of having cancer to begin with? People are afraid of having cancer, and sometimes you want a biopsy no matter what.
We have two camps. There are either people that really want to know if something's going on, or you have a camp of people that really don't want to have a biopsy. So this kind of helps in both sides of the fence. I think if people are really, really inclined to have the most valuable information to help them decide what to do, I think it helps on both camps. Because sometimes people really don't want to do a biopsy, and as a urologist, you feel very inclined to make sure you're not missing a cancer that could potentially cause them a very, very negative outcome. And so this could be a valuable tool to help them see the value of a biopsy and making sure you don't miss a life-altering prostate cancer. And so when they see that there's a high risk of their elevated PSA being associated with a clinically significant prostate cancer, they may then see the value on pursuing a biopsy or an MRI scan. Or if the value is low, maybe then it's not so unreasonable to not do a biopsy, and both of you feel a little bit more reassured. And then on the other side, if someone has a very low PSA or they don't have a nodule, but they're really inclined in just doing a biopsy, but there's really not a reason to do so, maybe this may make them feel a little bit more reassured to not pursue some testing that is really not necessary. So it's valuable in both camps.
Now you talked about a bit about how the at-home collection kit works. You get it right to your door, use urine to collect urine sample to be able to test for. I'll bet you can even have UPS or FedEx even pick it up from your door as well too. But I guess what we didn't touch on, if you know, like how soon can a patient start to know what the results were and what the next steps would be after the test?
To be honest with you, what I typically do with regards to this process, I typically set up, when we first talk about this stuff and we put an order in there, I try to set up an appointment within 1 to 2 week window of time. So that, and then we touch base with the company, let them know this test is coming in place. And then really it becomes a personalization of location, from that standpoint. So I usually kind of tell them, well, we need to get some labs. This goes into place. And then usually I have a follow-up appointment within a 1 to 2 week window of time for us to come back and go over the results from that standpoint, which I would do anyway if I was even getting a regular PSA follow-up from that standpoint.
Now tell us about what's your personal experience been with the at-home collection kit?
Well, I haven't gotten a test myself, but I've found very, very good results in terms of there has been no difference in terms of the process as opposed to when I've given the patients the box for to take home from here in the clinic or collecting the urine tests here in our office. So there hasn't been any kind of logistical differences in terms of the accuracy of the test result. We've had very, very, very happy patients who especially the guys who, and they're very concerned them having to come into clinic during the height of the pandemic in the late March, April time period from that standpoint. So it's been very, very convenient. I joke around with my office, the way the computer system kind of works a little bit, it requires a computer-based handwritten signature. And I kind of am not very gifted at using a mouse to do my very loop-de-loop signature, so they kind of joke around every time I have to sign one of these things. It's kind of very, very comedic for them when I do it, and I'm left-handed and I use my right hand for the mouse, so it's kind of very comedic when I say leave it at the end of the day and watch me struggle for all of these signatures. But it's been a very seamless process, and for a lot of our patients, that even when they come into the clinic, we almost seem to segue to the home delivery process because it's so much easier for the patients to do it that way. And the patients seem to be very appreciative of the process because they're able to get a test that reassures them of both a possibility of not needing a biopsy, or secondarily, the possibility of a biopsy that they truly do need in a way that's very easy for them to accomplish. And a lot of times, during the height of this, where people were very worried about going into a lab, it was an option for them to consider when they didn't want to go and get a blood test.
Yeah, it's almost as if it had Exosome had so much foresight into putting this test together that it's such a benefit to patients who are having to go through their prostate cancer journey during this time right now. So it's one less stop to have to go into the doctor's office or be exposed to the virus as you move forward in your prostate cancer journey. It's really great, really great.
There was also a nice contagious effect on other tests that began looking at doing the same thing, you know, from that standpoint. Again, in urology, we have a lot of urine-based tests for bladder cancer and other things that began looking at offering at-home options as well. And so hopefully we see more of the same happen. But again, the efficiency with which ExosomeDx thought of the process and began the process, and then you know, amazingly, when we went from the beta process of figuring out to the rollout nationally has been to other urology groups, it was very impressive. And again, most importantly, to patients nationally was very impressive.
It's terrific. It's you know, what a marvel of we continue to make more and more progress on the medical side to make it convenient for patients and get them on the right pathway, on the best pathway forward in their prostate cancer journey. So I wanted to share with everyone that for more information, everyone can go to one of two places. I actually urge you to go to both. One is go to the patient section of ExosomeDx.com and download a doctor discussion guide that can give you questions to ask your doctor about this test and when it's right for you, and request that information. Or you can also call 844 Exosome for more information. And then the second place I'm going to urge everyone to go to is zerocancer.org. There we have a program that's called 0360. It's a free one-on-one patient navigation program. So if you have any financial hardships or concerns around insurance, please go to our program 0360 to be able to help you out and keep going in your prostate cancer journey and keep the fight going, so we can all pull together toward ending prostate cancer. Dr. Kasraeian, thank you very much for joining us today and taking time out of your busy schedule to come and talk to us all about the Exosome DX test, and we appreciate it immensely. And thanks for joining us, Sally.
Very good. I mean, one last thing I want to kind of mention, you know, the work that Zero Cancer does, which is very, very important, allows
Love how we were just talking about the
research that and the fun technologies of DX and other amazing. It's amazing that it allows for things like this to happen, to allow patients with cancer to become more personalized and become more individualized sound in the community and the academic centers, to be able to push the envelope for us to do better in trying to make the diagnosis of prostate cancer, the advanced diagnostics of prostate cancer in terms of the imaging, and then ultimately the management of prostate cancer become more and more personalized, individualized, to the point where in the future we can potentially think about ending prostate cancer. We're not there yet, but hopefully we can get there someday. And again, the lessons we can learn in prostate cancer can come from the amazing advocacy and amazing work that breast cancer has done through its history, with the strong advocacy that starts from the patients' families, and the researchers and the advocates through the world of breast cancer. And we can see how breast cancer and prostate cancer are not too different in terms of the diseases that they are, except for in terms of maybe the pace with which breast cancer moves compared to prostate cancer. But we can learn a lot from that, and prostate cancer can, in the years to come, gain the advocacy, we can gain the research funding, and we can gain a lot of the momentum from the science to become as personalized so that we can know the personalized signature of the prostate cancer from the diagnosis to the management, from the day we have that diagnosis all the way to the treatment of organ-confined disease to advanced disease. And we're not too far from that in terms of the thought process. We just need to help teams like Zero Cancer and other teams like them get the research funding to help us move in those directions.
Absolutely. Well said, Dr. Kasraeian. Yeah, we need to blaze a path forward like they've done so well in the breast cancer space. And it all comes down to what we call zero champions, people who do anything to help end prostate cancer. And that's critical for us to be able to push forward on the research front and to be able to forge new innovative diagnostics, like we talked about today, new treatments, and eventually an end to prostate cancer. And among those champions are you, my friend. So thank you for all that you do, and thank you for making time and giving your expertise and energy tonight.
Always a pleasure. I could talk about this all day long.
Thanks, Holly.
Take care. Be safe, everyone.
Yes, that's right. Be safe, everyone. Thank you for joining us.